for school days. Help for moms and dads of school-aged kids.
I tell parents, you're like a training wheel on a bike. Your job isn't to make the bike move. Your job is to keep the bike upright.
Those of us who are the true educators, we really want to be given the opportunity to educate the whole child.
We can get free college degrees based on all of the opportunities that are out here and available to our students.
Oftentimes, as parents, I think we want to protect our kids, but I think one of the greatest gifts we can give them is allow them to experience adversity.
Yeah.
Here's your host, Danita Bailey.
Well, welcome to School Days, Help for Moms and Dads of School-Age Kids. I'm Danita Bailey.
And I'm David Bailey.
According to the Centers for Disease Control and Prevention, suicide is the second leading cause of death among people aged 15 to 24, second only to accidental death. The pressures of the COVID-19 global crisis have increased rates of anxiety and depression, and early studies by health officials suggest an increase in the rates of death by suicide in teens. Recently, a student in our school died by suicide, which prompted me to want to provide information and resources to our listeners. Suicide is one of those subjects that no one wants to talk about, and the silence is killing us. The American Society of Suicide Prevention says that most people who die by suicide tell someone they plan to hurt themselves before they take their lives. We as parents and loved ones and friends need to know the signs to be better equipped if and when we hear a cry for help. But before we go any further, let me just say it does take a village. If you hear a great parenting tip or nugget of advice, share it with your parent friends. Facebook it, Instagram it, tweet it, and link it in, and add the hashtag School Days Show and hashtag I am School Days. And also, we do want you to be a part of the show, so if you have any questions or comments, give us a call at 214-444-5575, or if you have joined us on Facebook, we would love to talk to you. Just drop us a line there. So, Dave, let's jump right in and welcome our guests. So, we have three distinguished ladies here today to talk to us about suicide prevention. And if you guys could just tell us your name, your organization, and how you became involved with this cause. Let's start with Kristi.
Hello. Thank you so much for having us on.
Well, thank you for coming.
You're welcome. My name is Christy Wiley. I am the program director of the Jordan Elizabeth Harris Foundation, and we do suicide prevention for children, teens, and adults. We're located in Fort Worth, Texas, but we serve Tarrant County and the surrounding rural counties. And we have two main programs. We do a lot of suicide prevention trainings that are based in QPR. QPR is question, persuade, refer, the three simple tools anyone can learn to save a life from suicide. And we also programmatically and financially support a program called Hope Squad in 89 schools across 9 districts here in our area as well. Hope Squad is a peer-to-peer suicide prevention program in our schools. What we know is 7 out of 10 kids will tell a friend before they attempt suicide, but that friend won't tell an adult. So we like to teach people the warning signs of suicide, and then most importantly, teach our young people how to connect their friends to a trusted adult.
Okay, great. And from your bio, I found that you have a background in theater.
Yes.
Jazz hands
all the way.
Yeah, so that's jazz hands all the way.
I think about every 10 minutes we're just going to just give us some jazz hands. How about this? Just hit it up. Just hit
lighten it up. Yes. So how did you, that's quite a departure from theater to suicide prevention and not the nonprofit world. What was kind of the, what made you want to delve into something like this?
Sure. Well, so I started in theater and opened up a theater in Albuquerque, New Mexico. But after I had my daughter, I needed to move to some more steady work. And I found that working in nonprofits and doing fundraising and special events was a natural transition. But now for the past 3 years, I went from fundraising to the program side. But what makes me so happy to be where I am and how I was called to the program side is that I myself suffer from depression and anxiety. And I have contemplated suicide when I was in college. And I am just an advocate to talk about your mental health. I'm an advocate to, I am on an antidepressant called citalopram. I'm on a treatment plan that works for me. So it's about bringing the conversation to light about mental health and suicide in particular, and knowing it's okay to not be okay, and teaching people. Now I get to teach people. So I do get to use, that theater background is I get to do many trainings, and I've taught over 5,000 people the suicide warning signs and how to find somebody help. So it's a great way to tell my own story, but also bring awareness and also end the stigma around talking about mental health, which I think is so important.
Yeah, absolutely. Thank you so much for your work.
You're welcome.
And Carol, let's find out about you next. You're on mute, though.
That would help. Thank you. My name is Carol Deely. I'm the president and founder of Gabriel's Light. Gabriel's Light's an organization that my husband and I founded 1 year ago in honor of our son, Gabriel, who died by suicide at the age of 12 in November of 2018. We found out many things after he passed away that we felt that if we had known before he had taken his life, that we could have done an intervention. And our mission is youth suicide prevention through education, including signs of suicide, and we also financially support Hope Squad at schools in Illinois, and cyber safety awareness, which is monitoring and alert systems on school and home devices, such as BARC technologies, and kindness campaigns, is standing up to bullies and trying to stop the nature of bullying.
Excellent.
So appreciate the opportunity to be here today.
Well, thank you so much for your
being
work.
here.
Yeah. And last but not least, Nicole, Dr. Fisher.
Hi, thank you for having me. So, I'm Dr. Nicole Fisher. I'm a psychologist with the Great Life Counseling Center. We are located in Addison, Texas, and we're a team of different psychologists who do outpatient therapy. I work with the full age range, but I have a particular interest in working with adolescents particularly. I think they're great ones to work with, and they can be both fun and challenging to work with. And I'm particularly excited that you are bringing up this topic, because I think it can be an intimidating topic for many people to approach, but that much more important to discuss.
Yeah. And truth be told, this is kind of a topic that I had buried in the back of my mind that we needed to address. It was on my list, but I didn't let it come to the forefront until we had an incident at my son's school, and I was like, we've got to give an opportunity for our listeners to hear what to look for and what to do if they hear some warning signs and things. So thank you guys all for being here.
Can I just add something real quick here?
Sure.
So, as I've been back on campus at my school for the past 6 weeks or so now, and it's draining. You're looking at I teach 7th and 8th graders, and looking at a bunch of students who are just looking at me like I'm crazy all day long, in silence. It's hard to get kids to engage and interact. I know the teacher morale is low, not defeated, but it's a whole different world now. Our students are quiet, they're isolated, they're in their own worlds, where they're just going from one video to the next. Not in we as a teacher, we have the pressures of maintaining academic standards and excellence, but also these are human beings, and they have challenges, and they are going through things and we don't even know. We don't have a clue what some of these kids are going through at home, and juggling. For me, I spent the first many weeks just building relationships with my students, not just let's dive into the content, but how are you? Trying to bring humor into it, just trying to engage them in ways. And I'm sure that right now, especially during this pandemic, is probably we don't know parents, people getting laid off, and just different types of challenges there that the pressures that kids are going through right now are probably higher than ever. And I think this is a very timely season to do this in, as cases are rising and as it's getting more intense. That I think this is a great time to do it. And I'm just from being back in the trenches, I can say that it is. I can see how during this season it could be challenging for students, and why this topic is needed right now.
Yeah, and teachers. And I was talking to a principal friend of ours, and she's a high school principal, and she said there are plenty of her teachers that are coming into her office and having meltdowns and needing to go get some help. So, yeah, this is definitely timely.
Yeah.
Yeah. So, I mentioned in the intro that there are some preliminary studies or signs that the COVID-19 crisis is making numbers of death by suicide rise. Is that what you guys have seen in your own practices and with the students that you guys work with?
Well, I can speak for myself in that I've had a number of parents contacting me with concerns about their children and asking, what should they do? Who should they talk to? How serious is this? And parents, this is not, like we were saying, this is difficult subject for parents to talk about. By the time they get to me, who is just really another parent, but by the time they get to me, they're pretty desperate. And it's 2 or 3 a week for me.
Oh gosh. Anyone else?
Yes, so I think we are seeing, so from a statistical standpoint, it's pretty early to look at whether overall that there's an increase, but most definitely it's looking that way. And it's important to note that suicide has been on the increase for many years now. And with the pandemic, we have to only imagine that's getting worse because of some of the factors that were being just mentioned. The isolation, we know that economic stress often is a factor because of the financial pressures. We know in previous years, like in the 1918 epidemic, that later results suggest there was an increase in suicide after that. So although it's too early for statistically to say it, it's pretty, one can guess. And although I only work personally with a small sample, it sounds that many people are going into crisis a lot more frequently.
Mm-hmm. Yeah.
And we also know that the crisis text lines, where, if there is a silver lining in this whole COVID situation, we know that more people are taking advantage of some of the crisis text line resources we have. The Suicide Prevention Lifeline, the crisis text line, which is 741-741. But what I want to echo is what Carol said, is that, by the time a parent knows that something is going on, I don't want to say it's too late, but by the time a parent knows, it's been going on probably for a while. Mm-hmm. So that's why programs like the Hope Squad is so wonderful, because we are teaching members of a peer group, their peers and friends, to know and recognize the warning signs of suicide, but then most importantly, get that friend connected to a trusted adult. And then the programs like Bark and Go Guardian that school districts can use to monitor students if they're searching any sort of suicidal ideation on a network at school, those are also great alert systems as well. That way we can get to an issue as soon as we know about it and not after the fact.
Yeah, and speaking of the schools, I know that I've seen in our district that they monitor, and we were talking about this a little bit earlier before the show. Is monitoring enough? And by that I mean the school districts have like keywords that pop up if somebody says something like maybe die or kill and things like that, that alert them to know that they need to contact someone. Is that sufficient? Are there better ways of protecting our kids?
I'm a big proponent of the alert systems because it is just one other tool to see what's going on with the child. And a lot of times parents and educators don't know what's going on in someone's head, and that online behavior can be very telling. And so it's not the end all. Parents and teachers still need to be really involved on working with the children on, technology safety and asking them how they're doing and things like that. It's just one of the tools that it needs to be mandatory.
And what's the difference between monitoring and alerts?
So monitoring would be maybe you do have keywords, mm-hmm. and it just generates a report. An alert is where a live person is actually told that something significant is happening on a device, and it ties it to a student. And with Bark, it alerts someone at the school and the parent at the same time. Otherwise, if it just alerts the school, then it's up to the school to contact the parent or authorities. So it's what's nice is that you would have both alerts happening, and so on the weekend, the parents are always going to be the ones getting the alerts, but during the school day, there's the school and the parent.
Mm-hmm. I can say that at least at the middle school level, that many times it's challenging just to keep, it's hard to tell what's going on when you can't see the students, and many times the monitors are off. There's two sides of it. Some say, well, you need to get them on so they're engaged with the class, but also, some kids may be really going through some things, and sometimes I've heard of house shaming. That's a newer thing now, and looking at people's backgrounds, and because you're coming into their environment now, it's I'm hearing everything through a teacher lens as me being an educator, and it's kind of a catch-22, either one way or the other. Sometimes some of them are always on and engaging, and some of them I virtually almost never see. But I know they're there because I'll say, okay, give me a thumbs up, or they'll have the camera on, and they'll have the camera flipped up towards the ceiling fan. And I'll say, okay, let me see. Are you with me? And they'll put up a thumb or something, and they put the hand back down. But I think that there's definitely an opportunity now. This is just kind of a commentary from an educator standpoint, and any other educators out there that might be listening, to really press in with your administrator team and with the counselors to find out what's the best way to go about tracking for the things that you're discussing, because it's a little bit easier to see when a student's right in front of you, but it's a little harder to see when you may only see their face, you may not see their background, you may not see what's happening, or the cameras are off. And so this is this. I'm just internalizing everything you guys are saying right now, and looking at what's the best way to gauge, because sometimes you just can't tell sometimes.
Let me ask, is the Hope Squad helping with students that are virtual? Has there been new training on how to check in on your peers and see how they're doing even in a virtual world?
Yeah, there is, and we pivoted very quickly. again, Hope Squad National, and then also the Jordan Elizabeth Harris Foundation and other people working with Hope Squads, what we realized is that everybody kind of had to reinvent the wheel a little bit. And so what we know is, and then there was a lot of throwing spaghetti against a wall to see what sticks. And so what we have found is that we have, Hope Squad has really had to reimagine itself in a virtual place, not only so it can include those hybrid learners, but also if the whole point is connectedness and also community and recognize the warning signs both in person and virtually, what are some activities and how does the curriculum change? And Hope Squad National has been able to address that. So there are some great mental health lessons. There's also been some virtual activities that have been added to every single lesson. And again, it's that peer-to-peer piece is so important. Kids know more about what's going on than teachers or parents like to admit.
Yeah, they do.
And when I'm teaching kids, I'll be like, raise your hand if you know more than mama does about what's going on campus. And they'll be like, and so we know that. And so if we can do two things, if we can not only educate them to know the warning signs, but also empower them to know that it's okay to go to a trusted adult, that we can't keep a deadly secret. And sometimes we'll ask, would you rather lose a friendship or a friend? And because they may be worried, oh, my friend's going to get mad at me, or they told me not to tell anybody. And we'll say to that student, and it sounds like a trick question, we'll say, okay, if your friend told you, but they didn't want anybody to know, okay, they don't want anybody to know, but they told you, do you really think they don't want anybody to know? So it's that education piece that is so important that then empowers them to know, okay, I do need to tell mom or tell my advisor or my teacher or whomever.
Yeah. Good. Very good. Let's talk about who's most at risk for suicide, because some people, there may be a misconception that suicide is only for troubled individuals that come from, difficult family backgrounds. Is there any truth to that? I mean, of course, there's a little bit of truth to that, but who really is most at risk?
I think really it's people with mental health will probably be at the most risk. We know that it is a symptom of depression to be thinking about death and to have experiences of suicidal ideation. And it's important to note that these are often unwanted experiences. People don't always want to be thinking about suicide or death, but they're in such a desperate emotional state that these thoughts just kind of come into their head and they can't help but entertain them a little bit. But people can have a perfectly happy life and still become depressed. There's a lot of different factors that go into that. I think someone's at greater risk of developing a mental health condition when they come from a troubled family, because that's what we call a risk factor. But there's plenty of other things that are also our risk factors, such as bullying or financial stress, medical conditions. These all impact our well-being. So it's kind of a holistic thing. All areas of our life impact how we're doing.
Yeah, and statistically speaking, we know that men die by suicide 3.5 times more often than women, but women are 1.5 times more likely to attempt. And one of the reasons why is that men are using more lethal means. And then as far as youth suicide, we know youth suicide, it's the second leading cause of death for ages 10 to 17. But we know that most people will tell someone before they attempt, and the same is true with youth suicide. And then another risk factor is our LGBTQIA youth. We know that they're 5 times more likely to attempt suicide than their heterosexual peers. So there are several risk factors, as Dr. Fisher noted. And going through a training like QPR, like a suicide prevention or some sort of gatekeeper training, can teach everybody these warning signs and these risk factors, and then you can yourself learn how to save a life from suicide.
Yeah.
I can speak from a parent standpoint. A few things looking back now that could have been an indicator for us was that my son's standardized test scores plunged from the year before. And there was no explanation. I remember asking the school, like, what is going on? How could this happen? He was, experiencing some weight loss. He said it was because of his braces, and he didn't like to eat things, and he was exercising more. But those were two things that, in hindsight, could have been an indicator. So, like, if you just see these, if you see a shift, it's worth it to dig into it.
Right. Yeah. Anything drastic, a drastic change like that, I could see would be definitely you want to look into that. What other behaviors should we be looking for?
Some other behaviors include giving away prized possessions. Many young people will start to give away their things that may be important to them. So we have an instance of a young lady giving her guitar to her younger sister. We had one young man give away his Apple Watch to a friend. Even for adults, we were called out to do a QPR for a construction firm because they had recently lost someone. After veterans, it is construction workers who have the highest rates of suicide, interestingly.
Really?
Yeah, but they had one of their employees ended their life, and we found out earlier that he had given away his toolbox. Well, here's the thing with suicide and mental health is we can make all these assumptions, right? Oh, they're okay. They're just going through a bad time. I'll talk to them tomorrow. I'll talk to them next week and check in on them. What we know is if you only learn one thing is that you never know unless you ask. And so while these mental health conversations can be hard to have, it does take bravery and courage to step in and ask the direct question. But what we know is that if you ask directly about suicide, are you thinking of hurting yourself? Are you thinking of killing yourself? That will lower anxiety, open up communication, and it reduces the chance of a suicidal act. So being direct and asking the question can help take a hot moment to a cool moment. But when you talk about behaviors, those are some of the other ones that we see, or calling or visiting friends to say goodbye. But definitely that irritability, that isolation, sudden loss in sleep, or sudden changes in weight or sleep patterns are also warning signs as well.
Yeah. Hey, Kristi, I love that you said be direct and ask if there's a problem, because I know some people may be concerned that you're planting that thought in their head. So to kind of talk to that just a little bit more.
Yeah, you cannot plant the idea of suicide into someone's head, and that's coming from firsthand experience. I started struggling with my mental health when I was in the 7th grade, but what do we think about middle schoolers, right? They're dramatic, or it's puberty, or it's a phase, or it's hormones. But what did my teachers and parents never do? They never asked me. I contemplated suicide when I was in college, and I didn't have enough bravery and courage to go see a doctor until I was 27. Well, I'm 40 now, and I'm so glad that I finally did that because I'm on a treatment plan that works for me. But at the same time, I say that story because I had never thought about suicide before, and I've not thought about suicide since. So you're either thinking about it or you're not. And let's say it is a young person. You know, we've seen kiddos as young as 6. Who are getting treatment for suicidal ideation. A 6-year-old may not know what suicide means, but they know that maybe they want to go to heaven, or maybe they want to be dead. And so asking the direct question is, what does that mean? What does going to heaven mean? What does being dead mean? So use the language you need to use, but be direct.
Oh, I want to ask, and I, I don't know. I don't think we ever discussed this on a prior episode, but and I haven't seen the show myself, so I don't really have much insight into it. But there was a lot of uproar perspective when that show 13 Reasons Why came on Netflix. And some were saying, but again, I haven't seen the show, but that it was planting or in promoting or I don't really know. But is there any influence or I don't know, infiltration of that show into the discussions of suicide in this, within the past year or two that maybe you hadn't seen before? Just wanted to get your intake on those things.
Yeah, so that show was very controversial, and I think the real issue with it's not that it was planting the ideas of suicide, but more of that it was glamorizing suicide. And indeed, we did see people kind of copycat suicide around that show. And
like actual suicides were based on the theme of what was happening was driven by the show.
We can't say it was
Influenced?
caused by the show.
Reflected.
But we can say it seems very influenced by the show. And so I always have geared away from the show. It's very provocative in that way, and it seems to be less than helpful. Rather than normalizing or starting the conversation, it seems to be having a kind of a unhealthy reaction.
Yeah.
For me, so again, it's that difference between glamorizing or glorifying. And what we see is that these contagions sometimes can happen if there's a death by suicide.
Yes.
So what you have to be careful of is you need to find a way to honor that person without glamorizing the way that they died. So, you can imagine that many kiddos or even adults who are going through something like this, maybe they may be thinking, nobody cares about me, I'm a burden to others, so whatever they're thinking, and they can think, oh well, if I end my life, then people will know, so it is a fine line between making sure we're honoring those that we've lost, but then also not glamorizing or glorifying suicide in any way, that's how you can get the recognition that maybe you wish that you had in a different place.
So, Kristi, for those of us that don't know, what is suicide contagion? That was a new term for me.
Gosh, and this may be better for Dr. Fisher or Carol. I don't have the direct definition, but it's when there is a suicide loss, that there are several losses after that in a set amount of time. So I'm sorry, I don't have the technical definition of
That's
that.
Okay.
So I'm happy to add off of that. So right on point though. So yes, it's when someone either commits suicide or attempts, or someone's exposed to suicide or suicidal behavior, and this increases their risk of suicide or suicidal behavior. So we often see that suicides can kind of happen in clusters, and it's that they'll kind of copy phenomenon, and it's this exactly. It's, oh, I see this worked for them, or they got that attention. And so one of the ways for mitigating that is to kind of keep the details revolving the death by suicide to kind of a minimum, not sharing too much about what happened or the factors around that or necessarily the whys or the results afterwards, but keeping short, concise stories, and ideally how it's presented in the media would be succinct.
Right. Yeah.
And I'm sorry, this is super important is that after a suicide happens, that the whether it's an adult workplace or whether it's on a school campus, that it is not swept under the rug as something we're just not going to talk about. Postvention. So in the suicide world, there's prevention, intervention, and postvention. And postvention is so important, having that crisis team, having a safe room, having that peer-to-peer response to know if maybe someone's struggling and needs that extra help. That postvention is critical in the time to reduce any sort of contagion or cluster.
Yeah, and do we see that happening with like celebrity suicides, that that we see an uptick in the number of suicides? They're nodding.
Well, I think that what I've read is that specifically Kate Spade and Anthony Bourdain, because there
Robin
were
Williams.
details shared and there was a lot of information, and that there were some copycat suicides.
Yeah.
I know you had mentioned, I don't know we brought up this terminology formally yet, but could you just distinguish between, we heard specifically death by suicide versus what I've heard
Committed
throughout my
suicide.
entire life is committed suicide.
Mm-hmm.
Could you share the difference in the two and why they're important?
So one reason we like the term, we prefer to use the term death by suicide, is when you use it, kind of highlights the mental health aspect going on a lot of the time, a bit more. Up to 90% of people that have died by suicide have had a diagnosable mental health condition. And it wants to highlight that. But not only that, when you use the term committed suicide, it kind of adds to the stigma surrounding suicide, because it's making it sound like they committed a crime. You know, that's the way we use that word typically is associated with that. So died by suicide or death by suicide is the less stigmatizing of the terminology.
Yeah, and one of the things about ending the stigma around talking about mental health and suicide is that we've got to start criminalizing mental health. And and it's twofold. Not only, committed sounds like you've done something wrong, you've committed a crime, but also too, when there's a mental health issue and we call 911 or we use a hotline, sometimes sirens blazing coming up to our house and banging on the door is not the best thing for a mental health issue, when something is going on. So it's also about training our first responders and having better resources to tackle some of these mental health issues versus criminalizing mental health.
Yeah. So, as a parent, as a friend, as a loved one, how do you respond to someone when they are having suicidal ideation? They confess to you that they're thinking about it.
I think it's just listening. I think that's the first thing we need to do, is create a safe space for them. And so many times when somebody might tell us that, they may not want to say anything because they do think we're going to be judgmental. But if we can ask those open-ended questions, tell me more about that. When did you start feeling that way? Have you talked to anybody? And really creating that space for them to talk. They also, and I say they, me, you want to be heard. And when you get to that spot, you sometimes think you're the only one that's been through a divorce. You're the only one that doesn't know how they're going to pay their rent. You're the only one that doesn't know how you're going to go to work and do three kids at virtual school. Whatever it is, you can't see your way out of it. So you need that person to be the helping hand and to, say, tell me more about that. Human nature, we always want to give advice, right? But when we're asking someone about suicide, we need to ask the question and then zip it. Let them talk, not giving advice, because again, most of us aren't mental health professionals. We can't fix them or fix suicide, but we can be that referral to get them to the wonderful professionals like Dr. Fisher or the counselors on our campus.
I want to share a concern that at least I've seen, and my wife and we've talked about it before. She doesn't know what I'm about to say. She always look like, "What are you about to say?" It seems like there is a huge gap in mental health professional, like the supply of mental health professionals for children.
Yeah,
is a big gap right now. With that said, there are counselors, but what are your take on? Just on that comment, just from what we've seen and what we have observed, and just our own personal experiences as a family, seeking help when there are challenges was hard, and we're pretty connected. It took quite a while to get to a good spot to find the right person to fit to help somebody through the highs and lows of some of the mental health challenges. What would you say is, as far as pointing out, I know there's always a first line response is a school counselor, but beyond that, and especially I'm assuming now it's probably going to be even more challenging, just during everything happening during the season of life. So just, I don't know what I'm trying to say. I just know that it's just a burden of mine, because I saw how hard it was for us, and just wanted to get your thoughts and take on that.
And to add on to his kind of non-question question, when do
I don't
you
know what to say. I'm just talking.
When do you know you need to speak to somebody,
Yes.
or you need to refer your child or your friend to someone? After the listening, then do you automatically go and say you need to talk to somebody? How does that work?
I feel like I got a lot of combination questions in there.
We want
sorry,
it all.
we
Give
do
it all
that.
to us. Yes. Answer everything.
I can try my best. I think it is harder to find child clinicians because there are less clinicians that treat children. And I think it's especially tricky right now because less clinicians are working in person. And so it comes down to, and some of us are indeed seeing children via telehealth. And so it comes down to, but that's not going to be suitable for every child as well. So for one, that's one reason why it's hard to find it. So usually it'll be one clinician will refer to another. When is it time to find? I think if it's never a bad idea to get an opinion. I think it's always helpful because there's always stuff that can be learned, and there's also the preventative components and it also depending on the age range. I might give more, say for an older child or an adolescent, it might not be too helpful if we're forcing them to come in. If they don't want to use it, they might not. So it can be tricky in that regard. One reason there are less child clinicians, in my opinion, is because really you're not just working with one person. You're not just treating a child. You're working with a whole family. And so truthfully, it's a lot more complex.
Yeah, absolutely.
The other thing I would say is that I had a parent that contacted me recently, and they were having really, like, they had a child that was really in crisis, and she told me this afterwards, and she just said how hard it was for her who she was an educated person, and she couldn't find a psychiatrist to get her child into, and because everybody's booked right now and they're not taking new patients and things like that. And so what I would say for parents, and that is a very common thing right now and even before, is that referrals are the best. So like if your pediatrician can make a phone call for you to a therapist that they recommend or a psychiatrist, or just talk to your friends and find out, because a lot of times it can just be that referral service of a person that will make a call for you to help you get in. And if, worst comes to worst, you're going to go to, take your child into an ER if they need to really be treated right away. And then within the hospital setting, they'll be able to refer you as well. It is not easy.
No, it is not. What is there a possibility? Well, there's always a possibility. How do I know if this is an attention-seeking behavior or dramatics?
You ask.
Oh.
You ask. We never know unless we ask. And the thing is I've done suicide prevention for counselors and even mental health professionals. And I've heard intervention specialists in a school setting say, well, Kristi, we know who those frequent flyers are. And I'll say, well, if they're a frequent flyer, this could be the flight. And we don't know unless we ask.
Wow.
And furthermore, what is attention but love and connectedness? If someone is using suicide to get your attention, something's going on.
Yeah.
If they're using suicide to get your attention, but they're not really thinking about suicide, something is going on.
Mm-hmm. Absolutely.
So ask.
Yeah, that's so good. And also, is there a difference between somebody that's talking about it and then and actually has a plan? Is that part of knowing when you need to seek help?
Yes, so I would say there is a difference because there's different types of suicidal thinking. So there's the more passive version, which is I wish I was dead or I wish I wouldn't wake up. So that's kind of a more mild version. And then there's people saying, no, I want to kill myself. And I've been thinking I'll run out into the freeway. Or actually, I've been collecting my sleeping medication, which is what we call a preparatory act. So they've been doing actions to get ready for it. So people that have the more active ideation are at a higher risk and are who we'll look into more safety planning for, or creating a plan to prevent anything from happening.
Yeah, so it's one of those things, if you've asked the question, they said, yes, I'm thinking about suicide. The other questions you want to ask is, have you thought about how? So that's the planning piece that Dr. Fisher was talking about. And then do you have a timeline? Have you thought about when? And when those three things come together, if someone said, yes, I'm thinking about it, here's my plan and here's my timeline, that is a high-risk situation where we need to do something immediately. If it's one of those things where you ask, have you thought about death or dying or suicide? And they're like, yeah, have you thought about how? Oh, no, I'm just really stressed out. Does that person still probably need to see a counselor or talk to a therapist? And does the parent still need to know? Do we all need to be involved? Yes. But the higher the risk is when they've said yes, they have a plan, and they have a timeline.
And when you say do something immediately, for those people who have those situations in place, what is the immediately thing that we do?
Go ahead, Dr. Fisher. Yeah.
if they say they're planning on doing something immediately, that they're in imminent danger, then that's probably the case where they might need to be taken to the ER or need to be supervised 24/7. There needs to be a serious safety plan in place, and I would say you would want a mental health professional involved most definitely at this point.
What I have told
go
parents is, in the moment before they reach out, it's not a imminent plan, but their child's talking about it, is to ensure that they have a safe home. And that's taking no weapons, no knives, no scissors, no medication, no alcohol, get everything locked up or out of the house or whatnot, and no closed bedroom doors. Somebody's always needs to be in your eye view.
And that's at the instance when they start talking about it, not necessarily they have a plan.
Well, I'm just saying, like, if it's been going on for a while and they say, like, I'm going to call somebody or whatever, and I say, well, okay, but in the meantime, take all those precautions, because you just can't be too safe.
Yeah, and I think this is not a political conversation as well, but we've got to address firearms. So we know that 51% of all suicide deaths nationwide are by firearm, but here in Tarrant County, it's 66%.
Wow.
The moment we know that someone, whether it's a kiddo or a coworker or a friend or a loved one, we've got to immediately start talking about access to lethal means, what is in the home. We also know that since COVID, due to the FBI surveillance and background checks, there's been a 91% increase in gun ownership since March.
Since March?
March. So we know that more firearms are in the home, and, I don't want to be flippant when I say this. If I'm on a diet, I'm not going to keep Oreos in the house. If I'm struggling with my mental health, it's all got to be out of there.
Yeah.
And so that's what we can do immediately to keep people safe for now, is by removing access to lethal means. We talk about firearms a lot, but here and when I've talked to pediatricians, younger suicide, so when we're talking about that 10 to 14 age range, what they're seeing is ibuprofen, Tylenol, and Benadryl. Why? Because that's what these kids have access to. So we've got to think about, that's where we can make a difference immediately, is by reducing access to lethal means, whatever that lethal means may be.
And so, Kristi, I mean, we do live in Texas, as you mentioned, and people are very attached to their firearms.
Texans, they love their guns.
We do love our guns in Texas. So are you suggesting that they are locked up and in a safe place, or are you suggesting removal from the home?
Well, safest is removal. So if you hear that your kiddo is struggling with thoughts of suicide, maybe grandmom or granddad can keep the firearm for a couple of weeks. If that's not possible, because we do know some people may not feel comfortable giving up their firearm, what we want to do is put time between the suicide attempt and the thought and the attempt. So an acute suicidal crisis can sometimes only be 10 minutes long. So if you have that kiddo who's like, okay, I didn't make the team, my girlfriend broke up with me, those are never the reasons anybody decides to end their life. Suicide is more complex than that. But if that's the precipitating event and they think, okay, I'm going to kill myself, I have a gun. If you can do something to put time, so even just putting the ammunition separate from the firearm, or even removing the bolts, or even putting the prescriptions and medications in a locked case, what you want to do is put time. That's what we want to do. But I also do want to mention there's a really great training that was done by Harvard, and it's called Means Matter. means matter. And there's actually a whole webinar and training course that parents and anybody can train on counseling on access to lethal means. So it can really help with some of those conversations around firearms in particular. And it was made by some guns groups, but it's gun inclusive language. Okay. Is what I'm trying to say, is where we just need to recognize that, we want to put time between the thought and the attempt, and that's the safest way to do it.
That's so good.
So as we're going on, just different questions keep coming to mind, and one of them is there are primary causes, I'm assuming, with a person who may be contemplating suicide, or they've done it themselves because of personal challenges and factors that may be coming into play there. Are there secondary factors, maybe what's happening in the home with the parent issues, something outside of themselves that may escalate suicide ideation? Actually, let me just ask that question first, because I know I can ask 3 or 4 at a time.
So is the question that can environmental stress increase the risk of suicidal ideation?
Yeah, so like, let's say a parent, loses a job, or there's, abuse, or, some neglect, something happening to them or outside of them that may elevate the thoughts of suicide.
Yes, external stresses can most definitely be a factor. That's not to say that someone else causes it, but certainly things, particularly events that are traumatic, can influence that, because it can go back into that. A big factor behind a big risk factor is hopelessness.
Yeah.
And so a stressor that contributes to that ideology would be increasing a risk factor.
The secondary question I have is, sometimes there's a stigma with getting help in particularly African American communities, that it's seen as a sign of weakness, that if you reach out for help, that is not something that you should do. You should be able to suck it up. And I'm sure it's not just within the African American community, but particularly, what are some words of encouragement, thoughts on how to encourage families, no matter what the demographic, to encourage, maybe even for themselves as parents, to get the help, but also for to encourage them to consider for their children as well.
So I think it's hard for people to acknowledge that they need help. And because it's hard, is it not that much stronger of someone to admit their vulnerability and take that action anyway? So I'm of the motto that there's strength in vulnerability. If you're willing to do that despite this internal message saying this would be weakness, I think you're taking the hard option by facing your challenges and by going to seek help, because therapy is not necessarily easy. You don't talk about the most comfortable topics per se. And so I always encourage people to see strength and vulnerability. Those can be simultaneous.
Mm-hmm.
And for me, I think that where does change begin? Change begins with you. Change begins with me. And so how we are talking about mental health when we're at church, when we're having dinner with our friends, when we're sitting around the coffee table, how we're talking about mental health will make an impact. And it's also reframing. When I do QPR, I like to ask, so tell me, if your joints were hurting, And you went to the doctor, what might you be diagnosed with? Arthritis. Okay. And what would be the treatment plan? Your doctor might prescribe some anti-inflammatory medication, possibly some physical therapy. Well, now let's say it's a different kind of hurt. It's that psychic, it's that emotional pain. Okay. You go to the doctor. What might you be diagnosed with? Possibly depression, possibly anxiety, whatever it may be. And what's the treatment plan? Possibly medication, possibly therapy. So what is the difference between our physical health and our mental health besides the stigma that is wrapped around our mental health, right? If I break my leg, I know I can't fix my leg. But if my brain is hurting or I have that psychic or something is going on and I'm not feeling like myself, I'm like, okay, I can put on my big girl panties and pull myself up by my bootstraps and I can figure out my brain. It's just, it's putting it and framing it in that way so we can understand that it's okay to not be okay, that we're dealing with the same thing and we've just got to talk about it.
Yeah. And, I love that popular culture society is starting to embrace that. There's a new song. I don't know who the artists are, but it's literally called It's Okay to Not Be Okay. I don't know if you watch This Is Us, but Randall on that show, he's a black guy that was raised in a white family.
Why you gotta be black?
He's black. He's just black. But he suffers from anxiety, and his wife had been trying to encourage him to go see a therapist, and he felt like that was taboo, that's not something that a man does and B, a black man does. But he has started to go to a therapist and has started to see some improvement. So I'm glad that Hollywood and other places where we can see ourselves are starting to let us know that it is okay not to be okay, and it is okay to get help.
I wanted to say one little aside, and to those who are listening out there that are of the faith community.
Uh-oh.
It doesn't have to be either or. It can be both and. It could be one. It could be both. It could possibly be. I just want to encourage people.
I think you need to explain that a little bit.
Okay. So if somebody says, well, I'm just going to pray about it. Good. And consider going to a doctor. Like I say, if you have a broken bone,
you're not going to pray just about
right.
a broken bone.
If you have a bone sticking out of your body, protruding through your skin, say, I'm just going to pray for it. Okay, I'm not trying to get so deep into this, but I'm just saying that if you're of faith and you believe in God, that He can use whomever He chooses, however He chooses, to help you in a way that best fits your needs. And this is specifically for the faith community, because I know many people who listen are of faith. Mm-hmm. And I just want to encourage that as well. And everyone knows on this show, I've got diagnosed with ADHD 2 years ago, and it's a part of my conversation with my students every day now, and it's quite liberating. And actually, it's helping to become a better educator, because now I can understand their needs more. And this was just as of 2 years ago. So I tell them, I said, like, y'all know I have ADHD. You know that. And I know that's a different topic, but it opens up new opportunities to get help in ways, in addition to the traditional means that maybe we have sought, that can be a part of the big plan of how healing can take place.
Yeah. So we have a couple more questions. We are definitely running long on time here. But I would love to talk about how to kind of reinforce our kids and our students so that they don't become suicidal, so that they don't start having suicidal ideation. What kind of things can we do to bolster them so that they are more protected from this?
I think one thing that I like to I use in my therapy a lot is strengths-based approaches. Like, I a lot of time will ask people, so what are your strengths, like personal strengths? And they can't answer my question. And that's so unfortunate, and this is true across the board, children, adolescents, adults, they can't tell me what they like about themselves. And so I borrow from positive psychology, so what goes right. So kind of the building them up, because self-esteem, a good self-esteem is certainly a helpful factor, and also kind of learning what self-kindness and self-compassion is, treating oneself. We say things in our head that I don't think we'd ever say to another human being.
Oh, yeah.
And why that's so ubiquitous is kind of beyond me, because it's almost also across the board. And so I think trying to instill these ideas early on in people so that they're like, no, I'm deserving to live a happy, healthy life is crucial.
Yeah. Kristi and Carol, do you guys have any thoughts on that?
I can just speak from personal experience that with children, and I had 5 children. Now I have 4. It was always about trying to help each one of them find what they were, their own strengths, and that each of them was an individual, and they didn't have to be like they're younger or they're older or the classmate or whatever. That they were each they each could have their own strengths, and if they had problems finding strength, like when kids are younger, they don't really know, that I would try to work really hard to help them find what they were really good at, and just try to reinforce that.
And I would just suggest finding any chance for connection. Especially, it was easier pre-COVID times, but now taking any opportunity we can to create those meaningful connections, whether it is with friends or family or loved ones, or even an online community that kiddo may enjoy, or that person may enjoy. So even adults, there are online communities for things that we're into, where we can reach out, but it's that connectedness that is so important.
And what about resilience also? We kind of live in a society where we kind of put pillows around our kids so that they're not negatively impacted by too much. So what are kind of your thoughts on that?
I'm going to let the doctor handle resilience.
I was trying to formulate my thoughts still. Resilience. So I think that's a message we have to start instilling early on, and also acceptance of failure, that it's okay, that sometimes you're going to fail and make mistakes, and that's okay. It's not a chance to beat yourself up, it's a chance to learn from. So it's tolerance for mistakes. And I think a big part, a big thing that parents can do to be helpful is to model talking about emotions, not just the positive ones. I think that's the more common one. We have no problem talking about everything that went well, but also talking about, yeah, I had a bad day, or I was angry, or I was sad, so that kids know that it's acceptable to talk about these things, and that going forward in their lives, it's normal to have these conversations so that they don't get in the habit of keeping everything to themselves.
Mm-hmm. Yeah. And we have a show, an episode in our archives that's called Teaching Your Child to Fail Well. So if you haven't listened to that, go back and check that one out. And we also have a couple of shows about social emotional learning, both outside of COVID and inside of COVID. So those are two that also check out. I'd also like to know some resources that both parents can go to help their kids, and then both and as well students and maybe siblings can go to help their friends and loved ones.
So I've got a couple that I love, and I don't know if you'll be able to send these out or how you get these out, but the crisis text line is amazing. 741-741. They are trained crisis counselors, and you can text. We know that so many people don't want to talk out loud anymore, but they can text. Another great resource for prevention, intervention, postvention, mental health lessons for the family is the Hope Squad website. So hopesquad.com. There's also a great website. It's a campaign done by AFSP called Seize the Awkward, that is geared more towards teenagers and letting them know to kind of how do we have this awkward conversation around mental health. But it's really geared towards teenagers. It's called Seize the Awkward. And then for men, because we know that more men die by suicide, there's a great website called mantherapy.com, which is a wonderful resource for people to go through and how to maybe talk to the man in their life. It's really kind of this Ron Burgundy type character. Yeah. So y'all should take a look at it. So, Hope Squad, Seize the Awkward, Man Therapy, and the Crisis Text Line.
Okay. And your website for the Jordan Elizabeth Harris Foundation?
Yes, and of course, if you're here in the Tarrant County area or North Texas, jordanharrisfoundation.org. jordanharrisfoundation.org.
And we will have all of these on our website, so don't have to worry about writing feverishly like I am. Carol and Nicole, Dr. Fisher.
I like the crisis text line quite a bit. I refer people to that quite often because it is, they're very responsive and it's so easy for people to do that. Then the Hope Squad site, I agree with. I also like the NAMI website on mental health, and the AFSP site has great resources. And so those are a few that specifically with regard to suicide prevention, I refer people to.
What was the one before the FSP? The NAMI? Did you say?
Oh, NAMI.
What is that? Spell that.
It's in. What does it stand for? Do you know, Dr. Fisher?
I believe it's the National Alliance for Mental Health. That doesn't.
NAMI. Anyway, that has a lot of great information.
National Alliance on Mental Illness.
NAMI.
Okay, gotcha. Okay.
NAMI, NAMI. Mm-hmm.
Yeah.
And GabrielsLight.org. We try to put resources on our website as we come across them.
Are there any particular websites or hotlines for the LGBTQ population?
The Trevor Lifeline.
Okay. And I've got that's 866-488-7386.
Yes.
Yeah. Okay.
There's also an individual veterans crisis line as well. Mm-hmm. I do the Jordan Elizabeth Harris Foundation. We have a resource card on our website that has all those national phone numbers as well. So you're welcome to go there too, Danita, and pull that and put on your website too if that helps.
Sure.
Yeah. There's also
No, go ahead.
There's also I like an app. It's called A Friend Asks from the Jason Foundation. Yes, and it has first it has some of the common hotlines and resources, but it also lists some of the warning signs. Mm-hmm. So that's specifically a suicide prevention app. I also like My3. That is a safety plan app for those that are having suicidal ideation. And you can email a copy to someone as well, but it includes like behaviors and contacts for when people are in crises. So, but all are free to download. I don't have any affiliation with any particular app, but those are ones that I frequently recommend to people just so that they have something free and accessible, so both for personal usage and for preventative for someone close to them.
Yeah. Thank you. And one last thing, the Hope Squad sounds amazing. And I know both Carol and Kristi are affiliated with it. And you told me that they are coming to my school district. So I'm really excited about that. If I, as a parent or teacher or an administrator, want the Hope Squad to come to my school and start being a program that we implement, how do we do that?
So if you're in the North Texas area, please contact myself, Christy Wiley at the Jordan Elizabeth Harris Foundation. We can answer any questions that you may have and help get you set up. And then I guess, Carol, how would they contact you?
Anywhere. They can just contact Hope Squad directly, and Hope Squad will, for a fee, will come to your school. In Illinois, Hope Squad is implemented by an organization named Alyssa's Mission, and the Hope Squad is funded by Gabriel's Light. So in Illinois, you can contact them, but really anybody can contact Hope Squad, and then they could put you in touch with local resources.
Right. So anybody in the United States. It's not just Chicago and Dallas
No,
area.
it's a national program.
Excellent.
That's great.
Okay. Well, thank you guys so much for all of your hard work in this very difficult subject, and for kind of demystifying it and making it something that we are less concerned about speaking about, and just being able to be able to have those hard conversations with people that we love and people that we care about. So thank you guys for your time.
Thank you.
They're waving.
Wow, it's just like
You're
my students in the
welcome.
classroom.
Yay.
There you go. Wait. We need some jazz hands. Hit it. All right. Yes. There it is.
Oh man, I hate Zoom calls for that reason, the muting and talking to yourself.
Yeah.
All right. Well, unfortunately, we are out of time. So thank you guys so much for joining us. Noggin Educational Foundation is the premier sponsor of School Days, so we always want to let you know what's going on with Noggin. We are currently taking applications for 2 of our programs that we love. Noggin offers 12 hours of free private tutoring to students through our educational coaching program. Also, through our ARD advocacy program, parents receive support in securing services and accommodations their kids need at school for learning disabilities and special needs. With the closure of schools, the education gap for low-income students has widened, and the one-on-one intervention we provide is vital. See our website, nogginfoundation.org, or email me at danita@nogginfoundation.org for more details.
I got this one, babe.
Okay, take it away, babe.
She always hogs the end of the show, so I'm gonna take this last spot. I'm taking it. As always, head to our website, schooldazedshow.com, for more information about all that we're doing with Noggin and for resources mentioned on School Dazed. Remember, you don't ever, I like to say, ever have to miss a show. See, she doesn't do that. That's my special thing here. All right, find us on Spotify, Apple Podcasts, Google Play Music, and pretty much anywhere you listen to your favorite podcast. I think we may have to update Google Play Music. I think Google Play Music has gone away.
And this, folks, is why I don't let him do the outro.
Well, I'm just saying that you put it on there. Guys, okay, so Google Play Music is not an option anymore. Sorry.
Yes, it is.
It is?
Just keep going.
Is it? Are
Just
you
keep
sure?
going, yes.
Okay, well, something with Google went away.
No, it's still there.
Oh, anyway, okay. So yes, you can. So go to Google Play Music and pretty much anywhere you listen to your favorite podcast. And don't forget to follow us on Facebook, Instagram, and Twitter at Noggin Foundation. That's NOGGIN, or for my math people, NOG²IN. Bam. See, you wouldn't have done that. Yeah.
And
See, thank you. Thank you.
There
Thank
you go.
you.
Can I do this last part?
Yes, I'll let you do it.
Okay.
Sure.
And lastly, we always want to end the show by saying that David and I are parenting by grace. We depend on God to give us the wisdom and strength that we need to raise our kids into flourishing adults. And if you'd like to know more about that, please feel free to email me at info@schooldazedShow.com. Have a great week and stay safe.